the big question is that you are heading into elections. You're already seeing a 1500% jump in cases. Your reproduction rate is 3.6. This is a big worry for you, is it not, as poll season kicks off?
See, the challenge is, of course, very much over there because we've gone through 2020, we've gone through 2021, and seeing a different variety of this variant, which is being highly transmissible and infecting just about everywhere. It seems to be infecting everyone, yet not being very highly where your hospitalization does not need to be taken. And yet you have to keep in mind that the coming up election has to be also dealt with at the same time. So the government has started putting in a lot of measures in all the districts which have already crossed over 2,000, and to ensure through the district administration that COVID appropriate protocols are well in place, and to ensure markets are closed, unnecessary big meetings and things will be totally, made to ensure that the total big meetings and small nukkad samaj and all will not take place.
Right.
And every person must have a mask, whether the person who's canvassing in small groups as well as the people in the villages must have masks. I mean, for the time being, this is what we are planning and going ahead.
Okay. But but the fact is now, of course, the Election Commission has made everything digital. But even before that, there were many political events being held, including by the BJP, where no protocols were observed. There was no social distancing and nobody was wearing masks, not even the Chief Minister.
I think the Chief Minister was wearing a mask because he's quite, that maybe in some meetings he must have not worn a mask, but otherwise he's pretty okay in that. He ensures that all of us wear a mask and he also wears a mask and all that. But yes, that is true. What you're saying is pre the election decision, there were a lot of big rallies and all, because these were programs which had to be inaugurated or which had to have a foundation laying stone by the Prime Minister or by the Chief Minister and different places. So this was just when the cases had started going up. And then when we found that the number of cases are going up very high, we suddenly decided to call off all the meetings and all that just before the Election Commission decided on the dates.
But would these meetings and events, I mean, did they contribute to the surge?
No, you see, when you are in a huge gathering, it does contribute to that. I mean, any huge gathering, you have somebody who's a COVID positive patient will, because being highly transmissible, this variant is going to be cutting across everywhere and trying to infect as much as people. But also what I would like to put in one word is that in 2020, 2021, what I saw was in the villages, there wasn't so much of a number of cases were coming out, or much less in villages than what it came out in the big cities. This is what I've noticed this time also. This highly transmittable thing, we are looking at all the numbers in all the big cities. And when I come down to all the smallest districts, and there the numbers are isolated and not in very large numbers, and which are easily manageable also. So maybe, I mean, there may be a herd immunity or something like that, because you have Delta variant as well as you have Omicron. Both are probably having the same sort of characteristics.
Okay, the same characteristics. But the other worry, of course, is that with these crowds and all of that, in Uttar Pradesh, the vaccination rates are quite low. Only 34% of the total population, not the target population, but the total population, only 34% vaccinated.
I don't think those figures are, I think, a little behind. As of today, I am told, I think, because it's in my this mobile itself, I think it's almost 50 or 51% now. Total number of doses which are given, 2 doses which are given, or 47%, sorry, 47 point something percent is what the 2 doses which we've already given just now. This we've increased the numbers over the last 10, 15 days. But where we are averaging about 17 lakhs, 18 lakhs per day.
Right. Sorry. Just to interrupt for a second, you're saying 47%, but that might be 47% eligible population. Of the overall population, I believe the figure is just 34%.
Yeah, the whole population. I'm also talking the whole population. I've got it in my mobile right now.
Okay.
I mean, I'm not being able to access it immediately, but I know it is about 47 point some percent
Okay.
I can give the figures to you later.
Okay,
I'm quite sure it's that.
We'll check the figures again, but even that is still not a very high number, is it?
You're correct, but then you also must see that we are 24 crores. We are the largest populated state in the country. So when you go percentage-wise, the same percentage might increase, the numbers might increase in the same percentage in smaller states, where they will show something like 90% to 95% or 80%. Because of our population and a huge population, if you go phase-wise, I mean not really phase-wise, if you go by the age-wise, keeping in mind the health workers, the frontline workers, 18 to 45, 60 plus, and even now 15 to 17, which we are doing in a very fast way and quite in large numbers. So if you see it individually, you will make out that the numbers are quite high and in tune with what is supposed to be in the country. But overall percentage does look a bit low.
Okay. Last question though, because how prepared are you in terms of oxygen and hospital beds? Because last time there was a severe shortage of oxygen. A lot of people were struggling. Uttar Pradesh government maintained that there was no shortage, there were no oxygen related deaths. Number one, do you concede that there was an oxygen crisis last time? And number two, are you prepared better this time?
There was a shortage of oxygen. It was all over the country. It was all over the world. The Prime Minister took cognizance of it immediately when this shortage came up, when the type of variant infected our lungs at that time. So the entire production of oxygen in the country was taken over by the central government.
Right.
And each state was given a certain amount of oxygen, the quantity to be lifted from different areas, from different places in the country, which everybody did. We did the same thing. Whatever oxygen we got from outside the state, and we financially helped a lot of oxygen refillers within the state who had closed down earlier for whatever reason, got them restarted in quite a few districts, and ensured that oxygen was easily available, at least to all the government hospitals, the medical colleges, the district hospitals, and to the hospitals which were connected to the medical colleges, like private medical colleges and private big hospitals, were also given enough oxygen to take care of the requirements. So there was a shortfall in between of oxygen all over the country. UP also had its share, but we worked on it as everybody worked, and we ensured it came by an oxygen express train, which we started by plane, by road. Whatever was possible, we put in every effort, and the whole country was putting in its effort. I think the Prime Minister was ensuring, apart from, I think, importing also from outside.
Okay. Well, at least an honest answer, Minister, that you concede that there was a shortage and you are trying your best to head it off this time. But thank you very much indeed for joining us.